Nikki Rycroft. Good morning, Nikki.
Good morning.
I hope you're well, because the sun is shining on us.
I am well, thank you.
Now, Nikki, you're a paediatrician.
Yes.
Now, I'm sure most people know that a paediatrician deals with children.
Yes, that's right.
And also, you work for the NHS under the primary care trust.
I do.
Is that
yes,
correct?
yes.
Yeah. Oh, good. So, okay, paediatrician. You work with children. Now, what do you actually physically work on children, or are you behind the scenes in other matters?
I used to see patients, see a lot of children, but these days I'm advising other people and working to really ensure that all children are safe. Children and young people are safe. That's my main job, in its widest sense. So we look at all aspects of children's safety, from injuries to water safety, to sun safety, to prevention of illness, all that sort of
thing. So you're working with, you're not actually working directly with children, you're working with
not
people,
anymore.
with other people that look after the children. So
yes, that's
we're
right.
talking about social workers and
that's right.
That type of person, yes?
Social workers, health visitors, children's nurses, other doctors in hospital, GPs, all sorts of people.
Children's safety, obviously, that's every mum's and dad's desire to keep their children safe and wrapped up, isn't it? Is there an awful lot of safety issues? Is it fraught with safety issues, looking after children?
Yes, it is. And there's so much we can do, so much that the community and parents can do to keep their children safe. Mm-hmm. We're trying to target specific things, particularly in the summer, water safety and sun safety, which I can talk about in a moment. And one of the things we're really trying to prevent are deaths of very small infants, which used to be known as cot death. And we're doing quite a lot of work on that at the moment.
Let's start with the cot death syndrome. It's never actually had a definitive definition, has it, of cot death. It's just that children, for some reason or other, stop breathing, don't they? What is the definition of a cot death?
Well, it's a sudden, unexpected death in an infant, almost always in an infant, and we can never find the reason for it. But we do know that there are many things that can be done to prevent babies dying, and that the work really started many years ago, because babies used to be placed on their front, and there was a very, very high death rate when babies were placed on their front, and then the Back to Sleep campaign prevented many deaths of children. So it's much safer for babies to sleep on their back, because when they're on their front they can't move, because they don't have the strength to lift their head up and move, and we think that was quite one of the causes.
I do remember from when I had young babies that they were slept on their front.
Yes.
And we used to have to buy a mattress that was breathable, I suppose, so that it was a safety mattress, they called it.
But all that's changed now.
Yeah, so that was actually more dangerous than sleeping on the back.
Absolutely, yes. So now we know that it's much safer for babies to sleep on their back, and when they're very tiny, they shouldn't be able to roll over, so it's very important there's nothing else in the cot, no pillows, no duvets, no soft toys, so the baby is just there in the cot, and they are not, they should be just in a sort of sleep suit, not covered with anything, and that's the very safest way. And it's really important that the temperature is right in the room.
Yeah, I know that we obviously had to keep the bedroom warm, this is what we were talking about, but also babies used to be wrapped up.
Yeah.
They were wrapped in blankets and their arms were pinned to the sides and couldn't move.
It's much safer to have...
not the case, obviously.
It's safer not to wrap them up in any way, but to let them be in a sleeping suit, and it's much safer to have a cool bedroom. And often, babies who are newly born and up to the first few months should actually sleep in the same room as their parents, so that they can get to them easily and check that they're all right. But the room must be cool. So particularly, in the summer, You need to check windows open or
yeah.
not anywhere near a radiator in the winter. No radiators on at night. That's really, really vital. No hot water bottles in the cot or anything like that. So,
no toys.
And no soft toys. No soft toys, just in case they get in the way.
Yeah.
But it generates heat, and just in case it gets in the way of the baby's space.
So in the very sad occasion where a mum finds the baby is not breathing, is there what should be the first aid for that? You know, what should a mum do beside panic? What should a mum do? Well,
immediately clear the baby's mouth and give a few puffs of breath and get somebody to dial 999. And usually the responder from the 999 service will tell them exactly what to do.
Over the phone, you mean?
Yes, over the phone, yes. They will explain to them what to do.
So what sort of period of time are we looking at? Because the baby might just have died, or it might have died 2 or 3 hours previous.
Yes,
what sort of time is there likely to be a revival chance?
Really, the chances are, if it has been in the last few minutes or quarter of an hour, 20 minutes or so.
That's it, is it?
Yes. I mean, the paramedics, when they come, they will try and resuscitate the baby. And very occasionally that works, but tragically, often it doesn't. One of the very, very important things is, in relation to cot deaths, is it has association with smoking in the house. And so everybody knows you shouldn't smoke in the house when they're children. But for babies, even the smoke in people's clothes is dangerous.
Is it?
And
this is the passive smoke that
yes,
you can't see.
Yes, there seems to be an association with parents who smoke, and hopefully they always smoke outside the house.
But
and
even
babies.
the smell of the clothes.
Well, it's difficult to tell, but it is more common. For parents who smoke, so that's an encouragement for people to stop smoking, really. And also, if people have had a few drinks, then it's really important to put the baby in the cot and not curl up on the sofa with the baby, not sleep on an armchair with the baby, because when you've had a few drinks and you fall asleep because you're very tired and the baby's with you, sometimes the baby can get into a position where they can't breathe properly.
Is it a good thing to actually take the baby into bed with you? You know, sometimes they cry, they always cry in the night, but to pacify them, you take them into the bed with you.
It's fine to take them into bed and feed them if you're breastfeeding or bottle feeding, but it's better to put them back in their cot.
To leave them in their cot.
Yes, just safer for the moment. People are looking into whether it is safe to have the baby in the bed, and if you're not smoking, you're not drinking, and you're a good light sleeper, and the room is cool, and you don't have any pillows, it can be okay to have the baby in the bed with you, but it's still...
There's always the occasion where you might just turn over and roll on top.
Exactly.
Now, on the smoking side of things, obviously in adults, smoking causes asthma and sort of... Or, I don't think it causes asthma, it aggravates asthma or something. Do young babies have asthma?
They develop it after. They can develop it after a few months. It sort of shows itself in different ways when they're very young. But any smoking around any children, particularly babies, is not a good idea at all, and it can cause all sorts of problems. In the winter, they get this condition called bronchiolitis, which is when they get very, very wheezy and choke up. Yeah. And often they have to go into hospital and have quite dramatic treatment for that. Wow. So, to avoid smoking near a baby is vital.
I'm a great anti-smoker anyway. I hate people that smoke. I don't hate people that smoke. I hate the smoking that other people do.
It's not good for children.
Because even me, at my tender age, when I'm with a smoker, I have trouble breathing. I really have trouble breathing. It makes me cough and I think, this is obviously not good for me, so how's it going to be good for the kids?
It's not good for children.
Right, well, that's cot death as such, and I mentioned asthma there. what other? We're talking babies. A baby's a baby until what? A year, I suppose, because it starts being a toddler,
infant.
doesn't it?
Yes, that's right.
So, what other ailments, diseases, or well, not diseases, but ailments are prevalent in young babies?
A lot of respiratory things, chesty things. They get a lot of upset tummies if their food is not, has been not properly prepared. But most of those things are pretty mild, and parents deal with them very well.
Yeah.
The important thing really is if a baby does have a temperature, and there are all sorts of ways of checking children's temperatures these days, but most parents know when their children have a temperature, to take it with a strip or anything else that they're using,
Yes.
and then if it is really high, and by high I mean sort of over 38.5, 39 degrees centigrade, then they should get them checked out, because that could be a sign of something quite serious. So babies who might be developing something serious, and we're thinking about brain conditions or meningitis, they usually become very, very irritable. They don't want to feed. And very importantly, and the thing that parents notice is when they pick them up and try to comfort them, if it's something mild, then a child will be comforted by a parent. But if they've got something really serious, they're still irritable and they're still crying, and that's the time that they should seek advice. You can't comfort them, you can't pacify them. And if they've got a high temperature and they're irritable, you should always seek medical advice.
So, so we have a baby that's not responding to being picked up.
Yeah.
Where should the first port of call be? Because young mums get very distraught about something wrong with the baby, don't they? Should you go to your doctors, in which case you have to wait for appointments, you have to wait for the surgery, or should you go straight up to the hospital? Because hospitals have more facilities than doctors' surgeries, don't they?
Yes. If they're all right and they're drinking or they're taking food and they seem to be, comforted a little better, it's okay to go and get checked out by your doctor. Of course, out of hours, you may have to wait for some time to be seen, and I would advise if a child definitely looks irritable, unwell, and particularly is a poor colour, then they should go up to hospital. And there will always be a paediatrician who will be available to check them out. And the emergency departments are always very, very skilled at checking out babies. So.
But the mums should obviously try to keep calm and look at it in an objective way rather than panic.
Well, it's easy to say that.
It's transferred to the baby anyway, isn't it?
Yes, it's easy to say that, but if the baby's really struggling to breathe or something like that, or going a very poor colour, it's easy to panic. So the best thing is to get whoever else in the house or a neighbour or somebody to come up with you or take you to the hospital.
We're talking here about things with mums and babies. But you also, I don't know if the word is teach, but you also talk to health visitors, social workers, and people like that. Because you personally do not have direct contact with babies and mums as such, do you?
Very rarely now, yes.
You lecture to the people that do.
Yes.
You're pointing them in the right direction, yeah?
Yes, and I support people who, if they have a query about something and they want to ask for an opinion, then they might come to me. But people are very skilled in what they do, and I have great confidence in everybody who's working with young children. But often it helps to sort of share a problem with somebody else, and quite frequently they share it with me. And I work with a team of nurses as well, who are also very skilled in looking at all sorts of problems.
Babies are very... There's such a subject that people get emotional about very, very quickly, don't they? Because poor little helpless baby.
But it's people need to be reassured that most babies are going to be very healthy and grow up and grow into strong children and not have any problems. So
the care workers, etc., that you speak to, a paediatrician is obviously children, but up to what age groups are we looking at here? You would be talking to people who associate
yes,
with
most
groups.
up to about 16, and after that, after 16 you're a young adult, so you are able to look after your own health, and there's a different people to consult, and people would go to their GPs or other doctors.
Yeah, so it's more on the lower end that the concerns are,
Yes.
because as you get older, obviously the problems are different,
Yes.
because children are developing into adults, aren't they? So you must have other problems as well. Okay, now besides the illness type things like meningitis, mums and anyone should look for the spots. The spots appear quite a long time after the disease is actually working, doesn't it?
Yes,
so,
it's difficult to say. Sometimes they come early, sometimes they come right at the end. But my advice is that any rash that you don't know what it is. For instance, if it's chickenpox, you can recognise it quite easily, and they've been in contact with somebody. But excuse me, if there's any other sort of rash, you should really always get it checked out by a doctor, and don't worry about testing it yourself. Go and
just go, because time is of the essence with those sort of things.
Yes, and talking about skin, so that I can make sure that people in the summer are protecting their children's skin, because it's very delicate. So my advice is always, when you're getting a child ready in the morning before they're dressed, then slap on the sun cream then if you know they're going to be outside. That's an easy time to get it on. You don't have to sort of take their clothes off and start doing it all over again when they're in the middle of doing something interesting. So put on a high factor sun cream. There's some very good ones now that last for 8 hours, and you could, if they're going to be on the beach, it's absolutely essential you get it on before they start going out, instead of letting them play for an hour and thinking, oh, I better put some sun cream on. So do it early.
Yeah, youngsters' skin is like tissue paper, isn't it, compared with our leather?
Yes, exactly. So it's really important to do that.
It is an important thing, because sunburn also can lead to cancers. Do these, is it called melanomas or something like that?
Yes, I mean, hopefully that's very, very rare.
In children?
Very rarely. It's in older people, but of course the damage can be done as a child. So it's good for children to be outside. It's good for them to be in the sun a bit, because they get their vitamin D from the sun. But and we of course always encourage children to be playing outside, and it's perfectly safe if they have plenty of sun cream on, and maybe if it's a really hot, clear day, to have a t-shirt on in the middle of the day. They can always go in the water with a t-shirt, and particularly if they're fair-skinned or red-haired, they're the people who are most.
Yeah, it takes very little while to cook, doesn't it?
Yes.
Now, like for instance, you wrap your child up, you've creamed her up, you've got them dressed, little shorts and whatnot. They go straight outside and jump in their little paddling pools and whatnot. Being in water or being on the beach, etc. Obviously, they need much more care.
Never
cream needs to be put on more often, because obviously it washes off.
Yes, although there are some very good 8-hour creams now, high factor 8-hour creams, which people can use. So as long as you remember to put it on, then as something is better than nothing. And if you don't have high factor, then put on low factor, because that's better than not putting it on anything at all. And even factor 15 or factor 8 protects a child. They should have high factor, but anything will protect them.
Okay, so we've got someone that hasn't. The child has got sunburn.
Yes.
Now, my mum had bottles of calamine lotion.
Yes.
You dab it on and you go white.
Yes.
What should be the first line of attack to someone, or the first line of treatment? So a mum said, I really burnt your arms, What should you put on? Should it be a cream? Should it be calamine lotion? What's the best?
It's actually if it's quite bad sunburn, it's actually best.
We've all done it, overdone it, and we've been very, very sore.
Yes, it's best not to put anything on at all, just to keep the child cool and keep them indoors. But obviously, if they're blistering at all, and often they get blisters on their shoulders, then they should go and see someone. They should yes, because the blister can, then burst, and then you can get an infection. But I hope that anyone listening to this programme won't let their child get blisters, because that means they haven't protected them, and
they haven't really.
And it isn't a good idea at all.
Absolutely. Okay, well, that's very good. I'll just check the notes here, and I can see one that we haven't covered, and that's the inner safety of a child by what they eat.
Yes.
Now, when we start off, a baby obviously has breast milk, which is the best food that a baby can have. But as the diets progress, say we're getting to the stage now where the child is having part solid stuff, where we're mashing food up for the child. What's the best sort of things we can give to a child without, because we can go on to really unhealthy foods, can't we? We don't start feeding them burgers at the age of 1, do we? What should be the natural progression through?
Well, as they're weaned and they're getting used to new tastes, they should have any sorts of vegetables, which are very, very good for them. And if you start a child on vegetables early, then they will like their vegetables. And it's rare for a child who's been given, mashed whatever, to reject vegetables later on. So try and avoid the sweet things. They can have any sorts of vegetables, fruits, which are also quite sweet and gives them enough sugar, rice-based things, and then as months go on, they can have a little sort of white meat like chicken or something like that. Eggs, if they're not allergic to eggs. So the best thing to do is expose them to a whole different variety. It doesn't matter what it is, but the variety is essential, and to allow them to deal with lumps, quite early, not always to mash everything, because lumps are good for them to develop their sort of chewing skills and also even to develop their speech. And variety is very, very good, and just if they occasionally have something sweet, that's fine, but they should not get used to the taste of sweet things over and over again.
Well, I know in the case of my mother and that, she used to get the dummy, dip it in sugar and stick it in your mouth.
Not good.
That's nice, you go, that's nice.
Not good. And they should have plenty of water. And if you start putting juice in their water, then they'll stop drinking water. So, keep away from the juice for as long as possible, although I know they'll like it. And then, even if you are going to use juice, then have it really well diluted, because it's not good for their teeth. And we want to avoid children getting too overweight, so we're trying to cut down on a lot of sugary things and fatty things.
Is probably a good thing, then, isn't it?
Yes, vegetables are good.
So if I'd have had mashed sprouts when I was a boy,
you'd have been
I would probably like sprouts better than I did.
But you see, children like, you might give them a stick of broccoli or something and pretend it's a tree, and then they'll eat the top of the broccoli and say, I've eaten the top of the tree, and you can make a game of it. And they like carrots and they like peas and all that sort of thing. So they do like vegetables, but they just need to start them early.
Yeah, so instead of giving a young child a curly whirly to eat, you should give them a carrot.
Yes. And if you're going out, they've got lots of little sort of sachets that you can give to young babies to suck on or whatever. You say they don't have to have sweets and things when they're going out. But of course they can have treats, and it's good to have treats, and rewarding good behaviour with a treat is absolutely fine. So
there is a thing at the moment, there's a lot in the news about young children being overweight.
Yes.
What they are. Now obviously that's a dietary thing, isn't it? Is anybody really naturally big? As my mum used to probably say, she's big boned or something,
Well,
but it is a dietary thing, is it not?
Yes. I mean, being overweight does run through families, and if everyone in the family is a big person, then the children are likely to be bigger. But again, it's really important to get the kids outside, running about, not plonked in front of the telly all day and doing outside activities and just watching what they eat. Yeah,
Good
not
food.
too many cakes, sweet things, biscuits. If they want a snack, you know, a bit of fruit or a bit of, you know, something that's good for them.
Something that's good for them,
Yeah.
Yeah.
Not to say they can't ever have treats,
Yeah.
but just not over and over again.
Now, recipes, when people cook things, because of our natural tasting, we love sweet things. The human body loves things that are sweet, don't they?
Yeah.
And obviously a lot of the recipes contain added sugar and things like that. And the worst one of all probably is salt.
Yes.
Now, salt obviously gives you high blood pressure. It's bad for you in many ways, isn't it? Should the parents obviously keep away from those sort of things?
Salt is awful, and
It is.
if you bring up a child being used to having salt on their chips or salt on everything or lots of bacon or whatever, they will be used to having salt.
Yeah.
And really we should try and avoid adding salt. There's plenty of natural salt in food. Unfortunately, in processed food or ready meals or whatever, there's lots of salt. So I think we advise parents not to add salt to children's food and not to put salt on the table. It's very difficult because everybody does. But
we never have salt on our table because I suffer from high blood
yes,
pressure.
so it's not good for you.
I mean, no salt on anything. In everybody's diet, no matter what we eat, there should be enough salt naturally.
And you know, things like crisps, obviously, a lot of the crisps are very, very salty. So you know, they're getting enough salt from the food that they're eating every day without adding it to food.
So are cardiac problems in children?
There are some cardiac problems in children, but they're different from the sort of heart problems that older people have.
Are they more generic rather than?
They're not. Well, some babies are born with structural problems in their heart, but that's always recognised at birth. Some young people can develop heart problems, luckily quite rarely, but they are quite serious. So if any child is ever breathless when they're, you know, resting, or breathless when they shouldn't be, or if ever they're poor colour, or they seem to be swelling up, or their ankles are swollen or anything, then they should always be checked out. But it is rare for children to have heart conditions, but unfortunately it does occur sometimes. And you know, when you see athletes who suddenly collapse, that's usually due to something wrong with their heart.
Okay, so we're coming to the end of our time.
Yes.
If you could sum up what a mum or a carer or a social worker or something should do, how can I put this? I sort of don't know quite how to put this.
It's by instinct, really. Yes.
Is it an instinct?
Well, a mother has an instinct about their child, of whether they're well or not.
Yes.
And you know, there are plenty of people to ask for advice. So if it's something minor, then don't worry and let them carry on. If they're eating and drinking fine, then there can't be anything too wrong. But if they don't look right, they're irritable, they're distressed, then they should always ask for advice. And then remember, wrapping up, keep putting the sun cream on. Remember, always watching children when they're near water. Never ever leave a child alone, even in a tiny paddling pool. They should never ever be left alone.
You can die in a very shallow pool.
Exactly. And obviously here in Felixstowe on the beach, it's absolutely essential that they're watched every second of the time.
All right, Nikki, thank you very, very much for coming to tell us about that. It's a very interesting subject. And I hope the mums and that don't get too, you know, ask. That's the thing. If in doubt, ask. Yeah.
That's right.
Thank you very much, Nikki. It's been a pleasure having you here.
Thank you.
And we look forward to maybe you coming back one day. Yeah?
Certainly.
All right, thank you, everyone. And we look forward to seeing you again tomorrow. Thank you.